In this context, we are encouraged by the initiatives already taken by the present government to integrate oral health into the primary healthcare system and to strengthen the preventive oral healthcare services. Such policy directions are essential if we are to achieve equitable and universal access to oral health care for all Sri Lankans. As the professions, we too bear a profound responsibility. It is our duty to ensure that the benefit of scientific advancement and the technological innovation reach every segment of the society, irrespective of socio-economic status, geographic location, or any other barriers.
Around the world, healthcare is being transformed by rapid advances in digital technologies, artificial intelligence, molecular diagnostics, precision medicine, and innovative models of care. Dentistry is no exception. These innovations provide us with remarkable opportunities to improve prevention, early diagnosis, treatment outcomes, and access to the care. However, innovations alone is not sufficient. The true measure of success lies in translating innovation into meaningful improvements in people's lives.
And the gold medal and scholarship are awarded.
Our chief guest for this evening, Dr.
It is a pleasure to join you this evening at the inauguration of the 93rd Annual Scientific Session of the Sri Lanka Dental Association. I must say, being in a room full of dentists is slightly scary for me because even as a child I was very scared of dentists. And even though your profession has improved beyond leaps and bounds, and dentistry is no longer as painful as it used to be when we were young, I must confess, I am still very much afraid of all of you. And being in this room reminds me that it's time for my annual checkup as well, which I need to schedule. First and foremost, I also wish to extend my congratulations to all students who have been awarded gold medals, the researchers whose valuable contributions are being recognized, and the recipients of scholarships presented during this annual scientific session. These achievements represent the excellence of our dental education system, the dedication of our academic institutions, and the commitment of our professionals towards advancing knowledge, innovation, and evidence-based healthcare. Their accomplishments will contribute not only to the further development of the dental profession, but also to strengthening the health of our nation by supporting a skilled, knowledgeable, ethical, and research-oriented workforce. I commend your dedication and perseverance, and I am confident that you will continue to make significant contributions towards improving oral health outcomes and enhancing the well-being of the people of Sri Lanka. When we speak about health, we often think about major illnesses and hospital care. But good health begins much earlier. It begins with prevention, with awareness, and with everyday choices that we make as individuals, families, and communities. Oral health is an important part of this journey. A healthy smile is not only about having strong teeth, it is connected to good nutrition, a child's ability to learn, an adult's ability to work, and the overall well-being and dignity of every person. I wish to extend my greetings and appreciation to the Sri Lanka Dental Association, which I learned today is the third oldest association in the country, for its long-standing contribution to advancing oral health care, professional excellence, education, and research in our country. For more than 9 decades now, this association has played a vital role in strengthening the dental profession in Sri Lanka. It has provided a platform for knowledge sharing, scientific advancement, and collaboration among dental professionals, while contributing significantly to improving the oral health of our people. Today, oral health has become an increasingly important component of global and national health priorities. Around the world, oral diseases affect nearly 3.5 billion people, making them among the most common, as was mentioned by the President, the most common non-communicable diseases today. Dental illness remains one of the most prevalent health conditions globally, as we just heard, while periodontal diseases continue to be a major cause of tooth loss among adults. These challenges remind us that oral health is not separate from general health. It influences nutrition, education, productivity, confidence, and at the end of the day, quality of life. A healthy mouth contributes to a healthy individual and ultimately a healthy society. Sri Lanka too continues to address these challenges related to healthcare and to dental care, to diseases, and specifically, as we learned today and as we have heard so often, oral cancer. 3 people a day die of oral cancer in Sri Lanka, and the unfortunate thing here is that it's preventable. This makes this even more of a tragedy, that we are still having to deal with something that is easily preventable. Also, dental illness or dental issues remain one of the most common health problems among children, while other diseases related to dental care affect many of our adult population as well. Oral cancer continues to be a serious concern, particularly among Sri Lankan males, with strong association with tobacco use, betel chewing, and betel quid consumption. Addressing these challenges requires a strong focus on prevention. This is consistent with our government's commitment to strengthening preventative health care, reducing the burden of non-communicable diseases, and ensuring that healthcare services reach every citizen. As we work towards universal public health care coverage, we must ensure that no one is left behind. While Sri Lanka has made notable progress in oral health care, recent evidence, including the National Oral Health Services Report of 2023, highlights persistent disparities in access to dental services, particularly across rural and underserved communities. Addressing inequities in workforce distribution, infrastructure, affordability, and service accessibility remains essential to ensuring equitable oral health care for all. These are challenges we face in healthcare in general, but when it comes to oral health, I think this is becoming even more of an issue, particularly if we have problems in our human resources as well. Sri Lanka has much to be proud of when it comes to our healthcare systems. Our dentistry, our oral hygiene is also something that we can be proud of. We have made progress over the years. Our school dental services and community-based oral health care programs have demonstrated the importance of early intervention, health education, and preventive measures. These initiatives reflect the principle that prevention is always better than cure. The theme of scientific progress and professional development represented by this annual scientific session is therefore highly significant. The exchange of research, innovation, and international best practices helps strengthen our healthcare system and ensures that our dental services continue to meet the evolving needs of our people. The government recognizes the important role played by dental surgeons, academics, researchers, and public health professionals in achieving better health outcomes. We remain committed to supporting a healthcare system that is equitable, accessible, evidence-based, and focused on improving the quality of life of all Sri Lankans. At the same time, we must continue to raise awareness, public awareness on the importance of oral hygiene, healthy diets. We hope with the introduction of the Ministry of Health's School Health Healthy Meal Program, we can address some of these issues, reducing sugar consumption among young children, tobacco cessation, and the importance of regular dental care. These efforts require collaboration between healthcare professionals, schools, families, communities, and policymakers. From the Ministry of Education's point of view, we really want to improve our school dental health care services, ensure that there is better oral hygiene among children, that there's better awareness, and also that there's early detection and prevention programs. We really need to improve on all of those as well. As we look towards the future, we must embrace new technologies, strengthen research capacity, encourage innovation, and continue developing a dental workforce capable of responding to future health and other challenges. It is also encouraging to observe the increasing participation of women in Sri Lanka's dental profession. I was particularly struck by the fact that it was a female student who won your gold medal, even though I see a majority of male dental professionals. I guess it's changing like in many other fields now. Greater representation, however, must also translate into equal opportunities in specialist training, research, leadership, and decision-making. As we strengthen the future of oral health care, we must ensure that talent and leadership are nurtured through inclusion, equality, and equal opportunity. On this important occasion, I congratulate the Sri Lanka Dental Association for organizing its 93rd annual scientific session and commend all dental professionals for their dedication and service to our nation and to our people. May this conference provide valuable opportunities for learning, collaboration, and sharing, and may it contribute towards building a healthier Sri Lanka where every citizen can enjoy good oral health as an essential part of overall well-being. I wish the Sri Lanka Dental Association and all participants a successful and productive scientific session, and I thank all of you for inviting me to this very important occasion and for your dedication towards furthering your profession. Thank you very much.